Hello everyone. In today's video, we will be learning about the anastomosis around the knee joint or the genicular anastomosis. So, first of all, let me introduce the arteries that are taking part in this genicular anastomosis. First of all, the descending branch of the lateral circumflex femoral artery, which is a branch. This lateral circumflex femoral artery is a branch of profunda femoris artery. Profunda femoris artery is a branch of femoral artery. And then you can see the femoral artery up to here. Then it continues as the popliteal artery. This dotted structure represents the popliteal artery. So another branch, like the last branch of the femoral artery before it becomes the popliteal artery, is the descending genicular artery. The descending genicular artery also takes place in the genicular anastomosis. Then you have the saphenous branch of the descending genicular artery. So the branches of the femoral artery that take place in the genicular anastomosis are descending branch of lateral circumflex artery and the descending genicular artery and a branch of descending genicular artery called the saphenous branch. Now when we come to the popliteal artery, 4 branches of the popliteal artery takes place in the genicular anastomosis, and they are 2 in the lateral side and 2 in the medial side. So the arteries in the lateral side are the superior lateral genicular artery. So the next one will be inferior lateral genicular artery. The medial side, correspondingly, we have a superior medial genicular artery and we have an inferior medial genicular artery. Now the the popliteal artery continues downward and it divides into an anterior tibial artery and a posterior tibial artery, and 2 branches from this anterior tibial artery called the anterior and posterior recurrent artery, and then a branch of the posterior tibial artery called the circumflex fibular branch of the posterior tibial artery. These are the arteries that takes place in the genicular anastomosis. Now let's learn about the anastomosis. So first, let's go with the lateral medial side. This superior medial genicular artery divides into 2 branches. One branch joins with the anastomosis with the descending genicular artery, and now it's another branch. This inferior medial genicular artery also divides into 2 branches. So the second branch of the superior medial genicular artery and one branch from the inferior medial genicular artery forms an anastomosis. The second branch of inferior medial genicular artery goes upward and it forms an anastomosis with the saphenous branch of the descending genicular artery. Now coming to the lateral side, just like the superior medial genicular artery, the superior lateral genicular artery also divides into 2 branches. But this inferior lateral genicular artery divides into 3 branches. So now when you come to the superior lateral genicular artery, one branch of the superior lateral genicular artery ascends upwards and it anastomoses with the descending branch of the lateral circumflex femoral artery. The second branch of the superior lateral genicular artery anastomoses with one branch of the inferior lateral genicular artery. Now there are 2 branches of the inferior lateral genicular artery. One of this branch goes and anastomoses with the circumflex fibular branch of the posterior tibial artery, and the last branch of the inferior lateral genicular artery goes and anastomoses with the anterior and posterior recurrent branch of the anterior tibial artery. So so now we have concluded the anastomosis around the knee joint or the genicular anastomosis.